Time now for a look at your health, and tonight we are talking about allergies, specifically hay fever, and don't let the name fool you. Here now, as he is every Tuesday, is Dr. Mitchel Goldman from UCSD. Thank you for being here.
Good to be here, Kathleen.
So how is hay fever if it is different from your garden variety allergies?
Well, it has nothing to do with hay, and you don't need to get a fever. Basically, it's from pollen, and there's lots of pollen in the air, especially with our Santa Anas. You know, pollen can actually travel up to 400 miles, so it can go really far, especially with the Santa Ana winds, and it's usually due to ragweed. One ragweed plant can do over 1 billion pollen particles a year.
And our weather has been anything but normal this year, so should we anticipate a difference in these fall allergies?
Yes, as you know and I know around my office and friends, so many people have allergies now, and the reason is we've had all these wonderful Santa Ana winds and wonderful days, but it's also giving us a lot of pollen because those weeds are literally pollinating in the air. And you know, up to about 8% of us have allergies to things like ragweed, and so it becomes very significant. But the good news is there are things that you can do about it. You know, you can see your doctor or your allergist and you can get shots before the allergy season. But usually it takes years to build up an immune reaction or response to the shots. And now there's some new things out that you don't have to get shots anymore. You can just basically put a little tablet underneath your tongue, and that will give you an immunity against the ragweed pollen. And you only have to take it either during the season or just before the season. So you don't have to get shots anymore, but definitely check with your allergist, and there's some really good treatments out now.
When is it time to call the doctor? When is that point, you think? You
know, it's when you really start to get fevers, headaches, when it starts to really interfere with your daily life. People with migraines actually will have more chance of getting migraines, up to a 30% more risk of getting migraines because of nasal allergies. So when things get out of hand, when you start sneezing too much, if you do get a fever, really bad headaches, that's when it's time to see your physician.
Well, aside from seeking, doctor's advice and all that sort of thing and medication, is there anything that hay fever sufferers can do to try to minimize contact? I mean, do they have to stay indoors?
No, they really don't. But if you do stay indoors, it's good to have a HEPA filter or your air conditioning on. But some really common sense things are when you come into the house, take your shoes off because your shoes will actually pick up a lot of pollen. If you have pets, you want to make sure that the pets are washed down because pets' fur is going to continue to have pollen. And then another one we don't think about is our hair. Now, of course, it doesn't matter about my hair, but for your hair, it's sometimes good to actually wash your hair when you come in for the evening. Because, you know, just walking out, especially if you're exercising and out in a beautiful day, in a windy day, you know, your hair is going to contain a lot of pollen as well. So take your shoes off, wash your hair, relax, and you can be home pollen-free.
I happen to like your hair. I think it looks good. What is allergic rhinitis, and what are the health risks with that?
Well, allergic rhinitis is basically when your nose is really running a lot, and that's usually due to an allergy. Again, most common one is from ragweed and pollens, but also mold. And so here in San Diego, where it's beautiful all year round, mold can actually continue to grow. So if you've got like continuous running noses and you find that you're taking antihistamines a lot, that's another reason why you should see your doctor. Maybe make sure it's not something really bad. Your doctor may also want to do a test to see if your sinuses are blocked, and sometimes you even require antibiotics because if you have an allergic rhinitis or an inflammation of your sinuses and they're blocked, you can also get a bacterial infection which can lead to ear problems as well.
All right. Thank you for pointing out the red flags, Dr. G. Dr. Mitchel Goldman, thanks once again.
Always good to be here, Kat.